Shirley Mack is a 12-year-old female who presents to the emergency room accompanied by her mother and grandmother. She has a history of asthma, which was diagnosed at age 10. She recently joined the soccer team at her middle school. Shirley has expressed her excitement to play her first sport to her mother and grandmother for the past couple of weeks. As she was outside practicing with her soccer team, she began to have difficulty breathing. Shirley stated that she had to take multiple breaks when playing and had fears that she won't be able to keep playing. Shirley's mom and grandmother don't understand why she had just started to have trouble breathing and doesn't want to take her off the team. Shirley is admitted to room 306 for difficulty breathing and has not yet been seen by a nurse or physician.
Mama, I feel like I can't breathe again.
Okay, let me call the nurse. Beep.
Hi, how can I help you?
Yes, my child is having trouble breathing again in room 306. Could you send a nurse now, please?
Yes, I will send her right away. Hey, Luke, the patient in 306 is complaining she can't breathe.
Okay, I'm on it.
Okay.
Knock, knock, knock. Hey, how y'all doing today? This is
hey.
Shirley, right?
Yeah.
I'm Luke. I'll be your nurse today. What's going on?
So my daughter, she's having difficulty breathing. She's been
her up.
having this difficulty for a
Sit up
long
for me.
time.
Yeah.
Since playing soccer, it's gotten worse. So we're
Okay.
just concerned about her.
Yeah, we're
Okay.
getting real worried. I don't want her to quit the team.
Yeah, I understand.
don't want to quit
Sorry
the
to hear
team.
that. Oh, I understand. So we're gonna sit you up a little bit. Does that help you breathing a little bit, hopefully?
Yeah, but it still hurts.
I got you. All right, well, let me listen to your lungs real quick, and we're gonna get your vitals. All right, take a deep breath in for me, and out. One more over here.
Mom, hold my hand.
Yeah, you're doing such a good job. All right, so it does seem like her breathing is a little bit fast, and her heart rate seems to be somewhat elevated. So I'm going to go ahead and page the doctor and let him know.
Okay. All right, Shirley. I'm gonna go to the cafeteria and get you some food. Okay.
Okay.
All right. Bye, Mom.
And also, the doctor has ordered that if your SpO2 is below a certain percentage, we're going to go ahead and administer 2 liters of oxygen via nasal cannula. So I'm going to go ahead and administer your nasal cannula. And let's see, got you on 2 liters of oxygen. So we'll see if that helps. So I'm going to go talk to the doctor. Hi, Dr. Q. This is Nurse Luke. I'm taking care of the 12-year-old female in room 306. She's got a diagnosis of asthma. She came in with some exasperated breathing. Breathing seems to be shortness of breath. She has elevated heart rate. She got slight fever, 99.2. Respiration's 26. Heart rate 120. BP 110 over 74. And the big worry here is that 89 was the 89% SpO2. Went ahead and raised the head of her bed with minimal relief. It helped some, but didn't seem to be too much. We then put the 2 liters of nasal cannula in as ordered. Her SpO2 did improve to about 91%. Her mom says she was just diagnosed with asthma about 1.5 years ago, but joining the soccer team does seem to have exacerbated her condition. Mom and grandma are currently in the room and very worried about her breathing and considering removing her from the soccer team.
Okay. All right, so I'll go in and take a look and see what I can do. Thank you so much. All right. Hello, I'm Dr. Q. I'm going to be taking care of you today, and I hear you're having some trouble breathing. Can you tell us a little bit what's going on?
Yes, well, I made the soccer team a couple of weeks ago, and I was actually excited until practice started yesterday, and I kept having to take breaths. I got tired fast and had to sit down. I just.
Okay, well, why don't you take a little rest break, and I'll let Mom finish telling us what's going on.
Okay. So she was diagnosed with asthma about 1 year ago. She was doing the soccer team, and she was doing really, really good with her breathing. But just recently, her breathing just gotten so much worse, and over time. And I just think I'm about to have to take her off the soccer team because her health is more important than playing soccer, and I just can't risk it.
Right, I completely understand. So asthma is a chronic condition that has to be regulated, and exercise is one of the main triggers that can induce an asthma attack, which is what Shirley is experiencing. So I know Nurse Luke explained, this to you, and he listened to your lungs, and I'm just going to take a quick listen too, okay?
Okay, but make it quick.
Okay.
It hurts when I take a deep breath.
Okay, all right. So, it does sound like you have a bit of inspiratory wheezing. So we're going to put you on a few medications to take you home with you to help your breathing. And if you take these medications on a regular basis and follow the rules, you won't have to quit your soccer team, okay?
That's great. My baby's gonna be a prodigy. Oh, Mom. She's gonna make it to the pros.
Yes, okay. So I want her to continue to take her albuterol inhaler. And I'm gonna call in a prescription for methylprednisolone, montelukast, and salmeterol. And I'm gonna have the pharmacist Jada is gonna come in to talk to you a little about your medications and specifically how to take them. So it'll be a few minutes, but in the meantime, I'm gonna give you a nebulizer treatment to help you breathe better for the moment, okay?
Okay.
All right.
Thank
Thank
you.
you.
You're welcome. I hope you feel better, okay?
Thank you.
All right. Take care.
Okay, hi, I'm Jada. I'm gonna be your pharmacist for today, so I'm just gonna explain some of your medications to you. I see that your O2 stats are looking a lot better. So, you've already had albuterol, but I understand you didn't necessarily know when to take it. So you could take it before your soccer practice, about 30 minutes before your soccer practice, just so that she doesn't have an asthma exacerbation due to her exercising and physical activity. And you will also take it when you're having an attack.
Okay, I understand. I am so happy that I can continue playing. I will be sure to follow the rules.
Okay. And I see that your physician also prescribed 3 more medications. So the first one is methylprednisolone, which is an oral medication, and that's just going to reduce inflammation in your airways. Also, you were prescribed montelukast, which will be a chewable tablet, and that's going to help you be able to breathe better and also reduce inflammation in your lungs. And you will be taking that one in the evening, every evening. And salmeterol, that will be another drug that you would take through your inhaler. And you could take that one also before you exercise, before your soccer practice. That way it prevents an asthma attack. So yeah. Do you guys have any questions for me?
Yeah, when can I start playing soccer again?
As long as you take your medicines as prescribed and when you're supposed to, you should be able to continue soccer and playing your next practice.
Thank you.
No problem. Y'all have a good day.
Thank you.
We're gonna now be doing some teaching to help teach Mom and help teach you, Shirley. So first thing we're gonna do is some triggers, how to avoid them. Some triggers are extreme temperatures for the asthma attack. Mold is another trigger, so make sure you're cleaning any mold around your house. Get rid of that. Dust mites, they're also another trigger. So you're gonna make sure you want to vacuum your carpet every week. There's also seasonal allergies that you have to look out for. Next, obviously, you guys know this, but exercise is a trigger. Like she talked about, give your short-acting beta agonist 30 minutes before exercise. And also pollen is another one, and there you'll give your antihistamine. So some early symptoms you all might want to look out for: shortness of breath, wheezing, cough, this real tired feeling. Those are some early symptoms of an asthma attack.
Okay.
We also have an individualized asthma plan for y'all, asthma action plan. It's called the red, yellow, green indicator. And this is to see if Shirley's at risk for an asthma attack using her peak flow meter. So if she's in the green, this indicates the child is not having any symptoms based on the peak flow meter. If she's yellow, it indicates the child is showing symptoms that are on the action plan and meds may need to be increased or decreased as written by Dr. Q. And if red, then that does mean you need to seek emergency treatment immediately. All right. How to use the peak flow meter? This is to get a baseline before any of the symptoms. You need to ensure your peak flow meter mark is at 0. You're going to start it at 0. You're going to stand up straight, take a deep breath, close the mouth around the mouthpiece, and blow out as hard and quickly as possible. And you repeat this 3 times, and you take the highest number. All right, the highest number. For your nebulizers, you're going to be placing your lips firmly around the mouthpiece and breathing in through the mouth and using a nose clip if needed. And before you leave, we'll be demonstrating that and make sure y'all fully understand how that works.
Okay. Thank you.